So bottom line is, on February 1st, in the middle of a Ford government press conference, the Ford government's health minister, Christine Elliott, was talking about reopening surgeries. She was talking about the quote unquote slow reopening, which is now the fast reopening, as they call it, of Ontario, the lifting of public safety measures in the pandemic. And she talked about ramping up surgeries for a whole array of conditions, for heart surgeries, cancer surgeries, pediatric surgeries, and so on. And in the middle of that, she said, and we're going to make sure that we allow independent health facilities to operate as private hospitals, and then carried on. None of the Queen's Park Media Corps who were there even picked up on the sentence, but it really was a bombshell, because what she was saying is that they're going to allow the for-profit clinics, the independent health facilities as they're called, that's a euphemism for for-profit clinics that exist in Ontario, to operate as full private hospitals. That means overnight stays, that means a whole array of surgeries and diagnostics that those facilities currently do not do, and we don't support them anyway, but it would be a massive expansion of what the private clinics that we already have do, and the bringing in for the first time, as I said earlier, of for-profit hospitals. Under the Canada Health Act, you are not allowed to charge a patient for medically necessary service. And so the way that the COVID testing clinics that are charging people $400 or $80 or $200, what have you, for COVID tests are getting around it is by saying, well, if you're traveling, you can get a test. And of course, they don't require you to prove that you're traveling, and they don't even really, it's just lip service. They actually don't even really ask. And then they're charging people for tests. There's no question in a pandemic that a test for a potentially fatal pathogen is a medically necessary test and ought to be covered under the Canada Health Act, like the rest of our OHIP covered services. We pay for them in our taxes. We should not be paying them in addition for their profits, essentially. But that is what they do. And so there's two things that happen. Under the Canada Health Act, you can't charge patients for medically necessary hospital or physician services. It doesn't expressly forbid the provinces from handing over the ownership of those services to for-profits. But what we've seen across the country is when you hand over those services to for-profits, the majority of them actually break the Canada Health Act and charge patients for those services. And so they bring in two-tier Medicare and user fees and so on. At that point, we can challenge them. But it has been court challenges. In BC, they've been in court for more than 10 years. Patients actually brought the original challenge. They had been charged, $5,000 for a sinus surgery, all kinds of different thousands of dollars for surgeries that, as I say, we pay for in our taxes. We should not be charged for when we need them. That is the principle of public Medicare. And yet the private clinics in British Columbia bill the public health system, and they charge patients as well an array of extra billing and user fees for those services. And so they brought the clinics to court. The clinics countersued. In their countersuit, they sued to bring down the laws that protect single tier, that stop them from extra billing patients and protect single tier Medicare. They've been, the province tried to audit them. They stopped the auditors from going in. The province then had to go to court to get the auditors into the private clinic. They won. They got the auditors into the private clinics. They found in just a month, I think it was hundreds of thousands of dollars of extra billing of billing of patients for medically necessary services. The lawsuit has continued on. It's been heard in court. Our side won. They're appealing. The private clinics are appealing. That verdict could come out any day. And so if anyone was to think that the handover of the ownership of our public hospitals and their services to private for-profit clinics is not a real and present danger to the existence of single-tier Medicare in the country, they would be deathly wrong. We see that, we've seen it on the ground in Quebec, we've seen it on the ground in British Columbia. But Nancy, I want to, because we're going to talk about action and we want to move to that, if it's okay, I just want to explain, just sort of lay out for people how we've won in actually stopping this stuff here and across Canada, and how we can win here, because we need to make sure that before we end tonight, we're going to set up to do that. And then we can, if it's okay, open up for questions and discussion, and we'll introduce the local coalitions then. So in Ontario, right now, I just want to make sure you know where we're at. Like where we're at, bottom line, we have the fewest hospital beds per capita per person left in the country, the fewest of any province. We have the second fewest long-term care beds per capita per person left in Canada. The hospital beds because of closures, the long-term care beds because of the offload of more and more complex patients into long-term care without building more capacity. We have the most privatized home care in the country. We fund our healthcare system always, between third last and bottom in the country by every measure, whether you measure as a percentage of our economy or our spending or our revenue, what have you, we're near the bottom of the country. In terms of hospitals, we're dead last. We vie with Quebec for being dead last in the country every year. So one year it might be Quebec, another year it's Ontario. In the entire industrialized world, in every sort of quote developed nation, we have the fewest hospital beds left. The kind of cuts to public health care and concurrent privatization are actually not normal in Canada, not normal in the world. They are the most radical pursuit of downsizing the public healthcare system and privatizing it stage by stage by stage that we can see across Canada and actually among developed nations. Because our hospitals are public, they're covered under the Canada Health Act, there's an incentive to move patients out where they face co-payments and user fees and where they can hand over services to for-profit companies, as they've done in long-term care, as the Harris government directly did, cut, 19,000 acute and chronic care hospital beds, open 20,000 majority for-profit long-term care beds, and privatize home care, right? That is exactly what we're seeing. We're now at a juncture where the Ford government is planning really radical cuts. The Financial Accountability Office of Ontario put out a report on the latest provincial budget by the Ford government. In it, they warned 5 things. They said, 1, they're overstating the deficit. So why would a government overstate the deficit? Well, because they're creating a crisis, right, to privatize, and because they want to be able to, walk in and say that they lowered it more quickly, et cetera. They said they're understating revenues. That's the amount of money the government takes in to pay for all of our public services. And they warned that that by any normal projections, they're billions of dollars a year under in revenues. And that may be because they're planning tax cuts that they haven't yet announced. And of course, that has started to come true. Just last week, it was revealed that they're planning to withdraw the payments for license plate stickers, and it's going to cost $1 billion to the Treasury. How many nurses can we calculate? Katha or Michael or Nancy, how many nurses would $1 billion buy, for something that no one has ever asked for? No one's agitating to get rid of license plate sticker fees, but boy, do we ever need nurses and health professionals and PSWs and funding for our healthcare system across the board. And they warned that the government is planning to fund after the election. So after the pandemic spending winds down, they're planning to fund healthcare and education at a lower rate than population need. And they warned that in order to meet their fiscal targets, their budget targets, they would have to accomplish $17.8 billion in permanent cuts to public services. In context, Mike Harris cut $18 billion in provincial revenues over the course of his term in office. Those were the deepest cuts in Canadian history to that date, and the deepest cuts in Ontario. These would be commensurate to the scale of the cuts that we saw under Mike Harris. And if you remember the first 2 years of the Ford government, that's what we're looking at, but on steroids. And so we have our work cut out for ourselves. We have to fight and win promises from all political parties, all of them, that they are going to fund the healthcare system in the way that we need. And I underline that every other province does better by virtually every measure than us, because these are political choices. They're not necessities. We can absolutely afford to take care of each other, and we have to do that. The consequence is what we've seen: burden-borne disproportionately on the elderly, on racialized communities, on the vulnerable, whose access to healthcare is worse, whose need is higher, and whose services have been just destroyed through cuts and privatization. And so we have a major fight on our hands. And I just want to end by saying we can win. We have won every time we've made privatization a fight in this province. We've won because, as Katha says, everyone, people of every political stripe, believe in public health care. There's almost no one. I mean, it polls incredibly high, 86%, in numbers that you don't see in many issues ever, oppose the for-profit privatization of our healthcare. But we need to make it visible. We need to show a visible fight. People need to be able to join in and do something meaningful to protect our public healthcare system. And that's what we want to do tonight. I just want to remind you that as a coalition, we fought and we stopped the Harris government when they tried to privatize cancer care in Ontario. That Cancer Care Ontario opened a private clinic in Toronto, cost $400 more per cancer treatment, with the opposition parties, both the Liberal and the NDP, who did stellar work in the legislature. We actually fought that to a total stop. And the Auditor General, we got the Auditor General in to do an audit of it, exposed that it cost more and stopped it. We stopped the for-profit MRIs and CTs. They wanted to bring in dozens of them under the Mike Harris government. We fought it down to, I think there's 7 left of those in this province. We stopped home care competitive bidding twice and entirely ended home care competitive bidding through mass rallies across the province. We stopped the closure of dozens of local ICUs, birthing units, emergency departments, entire hospitals, community after community, by holding referendums, by circling the hospitals, holding protests, endless action, lawn signs to do that. We stopped when Deb Matthews was health minister under the Liberals. She tried to bring in private surgical and diagnostic clinics. We held referendums town after town. We had maybe 180,000 people vote against the private clinics, and we stopped them. They tried to bring in, it was snuck into a budget bill by the Ministry of Finance bureaucracy. They tried to bring in an Uber Ministry of Privatization that would sit above all ministries and be able to order the privatization of anything under the Municipalities Act, under the School Boards Act, under the Public Hospitals Act, and so on. We stopped that. We filled the legislature galleries and we forced amendment to that budget bill, and we actually got all of that taken out and we stopped it. And then most recently in 2017-18, when Eric Hoskins was health minister, the Ministry of Health snuck into another omnibus bill, an attempt to repeal the Private Hospitals Act. The Private Hospitals Act, all it does is ban private hospitals. That's what it does. And if you repealed the act, you would open the floodgates to private hospitals. We met with Kathleen Wynne. Kath, I think, helped us with that meeting. We met with Eric Hoskins. Michael Hurley helped us, and we got lawyers involved. We met with the ministry, and in the end, they amended the legislation not only to repeal those sections, but to actually strengthen the ban on private hospitals and the limitations on private clinics in this province. We absolutely can win. And so tonight, I hope we spend, people will have some questions, but I hope we spend a bunch of time on talking about how we can, in our communities, actually mount the kind of fight that will actually stop this and win the funding. And so that's why we've asked all the political parties to be here. We need to push everyone on these issues, and we need clear commitments on the funding for public health care and on the stopping of the privatization across the board. Thank you.